Many of these patients reach deep brain stimulation at a phase when medicines are not working so well anymore. And actually, it's very life-changing at that point. Once you put the electrodes in and start the programming, which is a sequential process. Usually the first programming is about a month after the implant of the electrode, and thereafter we continue to do it at monthly intervals. So there is a process there. Patients get better. Usually they reach a peak around the third programming, roughly about 3 to 4 months out, and they continue to get better even a year later. The benefit is sustained for many years. There are many research studies that have looked into this. The benefit is sustained for 10 to 15 years in Parkinson's disease. In essential tremor, the benefit is sustained forever throughout the lifespan of the patient. And the same way in dystonia too. They may need some tweaking of this programming from time to time, but we can get them better. Their symptoms are extremely well controlled, and they are often able to return to their daily activities, and also they get a big increase in their quality of life.
It's quite remarkable in many instances. These individuals who may have been incapacitated by their tremor or by their rigidity now can start thinking about living normal lives. They can get out and about. They can take care of themselves. They don't need to have someone there constantly with them. And in many instances, they get what we would think of their life back in a very real way. This can be dramatically seen. Every once in a while, we have a patient who forgets to check their generator and whose generator the batteries may go out. It's a sudden change for them in terms of deterioration back to the way they were. And we're now set up so that we can, on an urgent basis, swap out and change the batteries in the generator to restore them back to the way they were with a system. And so it's of interest that now we have a whole cadre of patients who are very compulsive about checking their generators because they realize that their lives have been so dramatically changed that they have no desire to go back to the way they were.